I'm going to say maybe 5 to 7 years ago, my niece started to talk to me again. And the arthritis was there, and I started back in with the regimen. I'm going to try the Tylenol. I'm going to do the Aleve. I'm going to do aspirin. I have red light therapy at home, so I use my red light therapy. I went in and had the cortisone shots and the steroid shots, and then hyaluronic, is that what it was? And stem cell, I thought I would, but it was too costly. When you hurt like that, you're ready to find a way. And I had not heard of GAE at all. And I was reading an article, actually not about this clinic or anything. The article popped up um, about the procedure that had been done in Japan, whereas that's where this procedure started. And I think it was between 15 and 20 years ago, if I'm correct. And it just didn't have hardly any downside to it. And it would alleviate the pain. And I thought, man, I haven't been able to go up and down steps. You look for anything that's got arm rests or whatever, so you can push up and get off of a chair. And so this interested me. And after I read this article that was from the success in Japan, I thought, I wonder if anybody does that around here. And I just started Googling the procedure, and Medical Vein Clinic popped up. And I hit on that one first because it's really close to where I live. But I'm a huge believer in read every review that you can. And I started to read the reviews, and I'm like, people just don't have bad things to say about this place. And I called, and they saw me like the next day. And everything was just, I wanted it just boom, boom, boom. When you hurt and when you're ready. I've said this before, but it's like I lived with a 7 almost all the time for how bad do you hurt in my own mind, whatever a 7 might be. That wasn't what got me here. It was the days when it was like a 10, and you finally go, I'm going somewhere or I'm not going anywhere again. And so that was what ultimately got me in here. And from the way the facility looks to the sign outside, love your legs again, or fall in love with your legs or something like that. It's like when I pulled up, I just went, oh, this just feels good. It's kind of like a hug before you got in here. And everybody was just top notch and professional, yet there was a lightness to everything that I experienced. And it felt really comfortable. And I saw a lot of people the first day, and there was just no monkey business. There was not, we need to do this, and then we need to do this, and then we got to check that, and then we'll see in 6 weeks. And it wasn't like that at all. So when you're ready to make the move, they were ready to make the move with you. And I really appreciated and respected that. Um, and so as soon as they got the testing or whatever they needed, and went through my insurance to be sure that everything was all good, we started in, and my right leg has always been the worst one. And I just said, gotta start with my right one. And I thought going into surgery with Dr. Giannis was just a blast. I mean, I was just such an easygoing fella. And the girls that were in there to help him, it was from beginning to end, it was a very, very positive experience. Um, and I couldn't say anything negative about it. I have been, 1 week later, he did the other leg. And 2 weeks after that, I went to Vegas for a week. I got along very well. I had one setback, and I may have walked too much or done too much. Maybe part of it was my fault, but maybe not, because I did come back, and I called when I got home. My knees were just still so swollen. I mean, I was moving and I felt so much better, but I didn't have the range of motion that I had anticipated. And my knees were just so swollen, it bothered me. And so I called and talked to someone here. I don't remember who, but they said, let's talk to Dr. Giannis. We'll get back with you. So they called and said, we want you to come back in. We're going to do another scan, see what things look like. And I'll be darned, Dr. Janice came in for the scan and was just like Johnny on the spot. What is going on? And I told him, look at my knees. They're just great, big, and fat, and I can't bend them. And what is the deal? And the exam showed that I just had so much fluid in there. And so he put me on steroids. And it took a couple of weeks, but once that all got through my system, my knees, the swelling went down. I got my range of motion, almost everything back, better than it had been for years. Um, and I'm off and running. Steps still are not my best friend, but we're working on it. And I can at least go up and down. You know, little baby steps are the best. Those great big suckers.
Oh, yeah.
Yeah, no, they don't like me very well. But one of these days they will, because I refuse to let the old lady in. So